World Hepatitis Alliance, the first African to hold that position. So I'll turn it over to Dan for his remarks. Dan?
Right, thank you, John. Thank you so much for having me. And I will say good afternoon from Nigeria and good morning or good evening from whichever part of the world you belong to, you are now. So thank you, John. Thank you, the Coalition for Global Hepatitis Elimination. And thank you to the Global Task Force for Global Health, and then all the partners around for inviting me and inviting the World Hepatitis Alliance to be at this meeting. I would say we are, shall I say, the ultimate beneficiaries of this. We are the community. We represent the voice of the people, the hepatitis patients in this region. So I will start by the introductions. The World Hepatitis Alliance is an umbrella network of over 300 members in nearly 100 countries. And then we have, in Africa alone, we have over 70 members in the African region. And the World Hepatitis Alliance is structured like the WHO with regional offices, just like the WHO is structured. So in Africa, we have the regional board member, and then in Africa, it's a membership-based organization. So we have over 70 members in Africa. And then together, we represent the millions of people living with viral hepatitis across the continent. The next slide, please. So to us as a community group, PMTCT is more than just technical guidelines. It's more than just the policy documents, but it's talking about the human being, it's talking about the mother, talking about the woman, talking about the child, talking about the woman who lives in the rural community where she needs to walk kilometers to access healthcare services, where she needs to really convince her husband or the partner before she goes to the hospital, where she needs to carry the baby on her back, strap the baby on her back, and get to the health facility where she needs to get the vaccine. So it's beyond just the papers, beyond just the guidelines. We're talking of real human beings. We're talking about the mother and the woman who ultimately is what we're talking about today. So to us as a community group, testing pregnant women, linking them to care, and vaccinating babies is a maternal health, women's health, and children's health issue, and it's a fundamental right of the women and of the children to get this done. So the interventions to prevent mother-to-child transmission of hepatitis B are not new. The hepatitis B birth dose vaccine has been around for years. It's available for just little pennies, just like the Gavi representative mentioned. But globally, we're made to understand, of course, only 43% of babies receive it globally. And even looking at the other part of PMTCT, medications for treating pregnant women with high viral load has been there for years, but treatment is often always not available, especially in regions or in countries like Africa. So for us, advocacy, and that is part of what we do, is to gather political and public support for action. And that is why for now we're using the family-centered approach. We can see on our slide, we have the women. We are using the family-centered approach to drive public support. And in this context, to achieve this, we're hoping to work with parents, mothers, women, and families to speak up, to create the demand for the upscale or the scale up of birth dose vaccine and the prevention of mother-to-child transmission. We hope that in April, the No Help Global Movement will be launching a campaign encouraging parents to come forward and raise their voices to show support for testing for all pregnant women and vaccinating all babies against hepatitis B. Mothers and babies deserve these simple tools to combat hepatitis B. As an individual, I see this as an urgent crisis, and as an organization, we see this as an urgent crisis. And we're gravely concerned that PMTCT is not accessible to everyone. We're gravely concerned that the uptake of birth dose vaccine is very low, especially in Africa. Now, and just like I mentioned earlier, now this goes beyond just guidelines, but you will not appreciate this until you come around communities, you see the challenges, the barriers women experience, especially in some of our communities in Africa, in accessing care, when most often there's out of stock, or they can't even walk to the health facilities, or they even go and they have to use their money to buy vaccines in some instances, or when they put to birth with traditional birth attendants and the vaccines are not there. So to every mother that we represent, it is worrying to pass this virus to the baby. And the innocent baby is the victim at this end. So if the vaccines are not, if the uptake is not available. So I'll give an example with myself. I'm privileged. I have 3 kids. I mean, 4 kids, wonderful kids. My last daughter was born at a time when the health centers were on strike. The hospitals were shut down, and there were no health facilities in the public sector. And my wife had to put to birth in the private health facility. And unfortunately, they have no cold chain to keep vaccines. And it pains me to say that my baby did not get the birth dose at that point because the public hospitals were shut down for several months. And that is just one example of barriers that so many communities in Africa face: shut down in infrastructure, non-availability of the vaccines, even when the women are able to overcome other structural barriers or cultural barriers or religious barriers when they get to the facilities. So, but when we all come together and raise our voices, policymakers and international donors can see the urgent demand and need for action. Next slide, please. So, as civil society organizations need to be involved, and I'm glad that the Gavi representative also rightly mentioned that they are open to have conversations with civil society. So we are the community. We are the ones who understand the communities. We're the ones who understand the needs, who understand the barriers, the challenge the pregnant woman or the nursing mother have to face in convincing her partner that she needs to go to the hospital, the challenge that the communities face in that mother walking kilometers before she goes to access healthcare facility services, or the challenge of even motivating the healthcare workers to do what is needful. So it is important to engage civil society organizations, and it is important to involve us as a community and the civil society groups to drive the delivery of PMTCT services and to drive the demand and even the uptake of these services at the community level. Because we all should know that every country faces different issues when looking to implement PMTCT programs. And so there cannot be one size fits all solution to all. So that is why issues around stigmatization, issues around public awareness, issues around demand creation, breaking down the barriers that community people, women face, and even systems face, we need the community. And we're happy to, as the World Hepatitis Alliance, just like we mentioned, we have over 70 members across the African countries. So we're happy to share opportunities to leverage networking and to see that our members are fully engaged to drive this across the region. The next slide, please. So what is the World Hepatitis Alliance also doing is that we are an advocacy-based group, and part of what we're doing is that we're working with the organizations of the African First Ladies to drive advocacy on the PMTCT or the birth dose vaccination. So it is really unfortunate that we have these affordable and low-cost interventions available, but they're not being used. So that is why we came up with the strategy of working with these First Ladies. And we hope that very soon, well, we hope as we're engaging them, we hope that very soon, I hope in the next couple of months, we're going to give more details on what we're doing with engaging the First Ladies in ensuring that they drive this, they give the political will and drive in-country activities that will bring about uptake of the birth dose and PMTT services. And we hope that partners around will also join in this campaign. Later this year, the World Hepatitis Alliance will be releasing a white paper highlighting the importance of implementing PMTCT programs. And then we hope to highlight the lived experience of women who have not even been able to access PMTCT programs and the impact that has had on their children, themselves, and even their mental health. We hope that this will be shared in the coming months. And we hope that the community of practice around here will benefit from this report. So there's no need for, to have a generation of children that will come up with hepatitis B. It is our duty to ensure that children are protected. And as a community group, we're committed and passionate to drive advocacy and to work with all partners to ensure that this is done even across the region of Africa and even at the global stage. So the World Hepatitis Alliance welcomes Gavi's commitment to offering more support for the hepatitis B birth dose, and we urge that the Gavi should implement this program as a priority. I'm aware of what the Gavi representative talked about the disruption in healthcare systems due to the COVID-19. We hope that this delay will not be delayed too long, but that probably we should see ways to probably come back and ensure that implementation goes on across the regions. And this is because much as we've shifted focus because of the because of the COVID outbreak, but we shouldn't have missed opportunities to find people living hepatitis and linking them to care. And we shouldn't have missed opportunities of having children born during this pandemic that are not immunized, that are not protected. And yet we now have children or people that will have come up with liver complications later on in life. So it is our hope that the Gavi program will be rolled out and the delays will not be too long so that's not to cause so much other problems. So the next slide, please. So as we mentioned earlier, that we as civil society group, we're happy to be involved at all levels, and we are hoping that we'll be involved at all levels of implementation, and then to share our own experience as partners to ensure that there's uptake of these services at every level. So we need to see as a body, we want to really see the rollout of hepatitis or PMTCD guidelines as a health and maternal and child health right. And then we hope that this meeting will not just be a meeting where we just talk, but we hope that we're going to walk our talk, and all the partners across this room and all of that will really ensure that we put our hands on deck and we join forces to see that the African child, the babies are not left behind, even in the context of universal health coverage. I would say that in Nigeria, community-based groups are driving advocacy, driving awareness creation, and driving demand, just as other members of the village are doing across the region. We drive demand by doing community awareness, and even some of our members even take deliveries. For example, we have women in hepatitis in Africa, and some that have the skill, they help to follow up women, to take them to health facilities where they can access vaccines. I did mention earlier that it's unfortunate that in most African countries, the barriers women face are enormous, from structural, cultural, in some areas, religious challenges. Women face these barriers, so it needs a community group to be able to break these barriers, working in partnership with government and other institutions. So as a body, we are happy to be part of this, and we hope that these discussions will continue to improve access and uptake of prevention of mother-to-child transmission and the birth dose vaccination. Thank you.
Thank you very much. Excellent overview, both from your personal experience as well as the perspective of how a civil society such as World Hepatitis Alliance and your local partners can play a role in increasing understanding of prevention and the benefits of that, as well as working through the perceptions of risk or harms from that. And in that regard, looking at the chat, I mean, just you can comment on this, Dan, and also it started with Maud's presentation, but it's relevant to the presentations from yesterday, which was there's a lot of discussion around screening or testing of women